Vet Triage, it would be January 25th when this is posted. JAVMA, March 15, 2017 edition. This is a cool overview study, factors associated with anesthetic-related deaths in dogs and cats with primary care veterinary hospitals. This comes out of the Texas A&M University, Banfield, and the AVMA. They looked at risk factors for anesthetic-related deaths in pet dogs and cats. 237 dogs, 181 cats. Results. The anesthetic-related death rate was higher for cats at 11 for every 10,000 anesthetic episodes, which is 0.11%, than for dogs, which are 5 out of 10,000 anesthetic episodes at 0.05%. Increased age was associated with an increased odds of death for both species. Undergoing non-elective versus elective procedures had increased odds of death. Odds of death was increased for pre-anesthetic physical examination results that were not recorded versus physical exam results that were recorded pre-anesthesia, or if pre-anesthetic hematocrit was outside the reference range compared to being within. Odds of death for cats were greater when intra-anesthesia records for oxygen saturation as measured by pulse oximetry was absent. Underweight dogs had 15 times odds of death. For cats, odds of death increased with increasing body weight, but not with overweight body condition. So, introduction. In humans, dogs, and cats, there have been similar decreases in anesthetic complications compared with those reported in the early 1980s. A study found that the anesthetic death rate was 0.17% for dogs, 0.24% for cats. The odds of anesthetic-related rate, including animals that received both sedation alone versus general anesthesia, increase in both species with increasing American Society of Anesthesiologists score. That's called the ASA score, the ASA status. And it's very important for papers like this. Or procedures that had greater severity, major versus minor procedures, had increased anesthetic-related deaths. In those studies, the anesthetic-related deaths were greater for cats that weighed less than 2 kilograms or were 6 kilograms or more than for cats that weighed between 2 and 6 kilograms. And then for dogs, increased death with weights of less than 5 kilograms compared to those that were 5 to less than 15 kilograms. Endotracheal intubation and IV fluid administration versus none of those things were also associated with greater odds of death with cats. And then in dogs, odds were greater for those that were at least 12 years of age versus those that were less than 12 years. The odds of anesthesia death for cats was lower with heart rate when the heart rate was monitored versus not monitored, when pulse oximetry was used versus not used, and when both types of monitoring were performed. 47% of deaths in dogs and 61% of cats deaths occurred in the post-operative period. The results of these studies in the United Kingdom also revealed a lack of relationship between anesthetic death and drugs used. A study found an anesthetic death rate of 0.12% for dogs and cats. Sick animals, meaning those that have ASA status of at least 3 or more, had a death rate of 4.77%. The only risk factor identified in that study was poor health, meaning ASA status of 4 or 5 versus those that had 3. And the use of anesthetic regimen other than an anesthetic regimen involving pre-medication, administration of isoflurane, and administration of thiopental, ketamine, or propofol. Another study found that an ASA status of 4 or more versus 1, a status of 1, had increased risk of intraoperative and post-op related deaths, whereas opioid administration with or without a nonsteroidal anti-inflammatory death was associated with a decrease in these odds. All right, materials and methods in brief. These cases were between 2010 and 2013. Banfield Pet Hospital, general anesthesia, which they define as requiring endotracheal intubation and inhaling gas, was looked at versus sedation alone, which was either a face mask without the use of the face mask without the use of endotracheal intubation also counted as general anesthesia. Any sedation alone was considered chemical restraint that was insufficient to allow endotracheal intubation. There was no gas anesthesia used. The ASA score, 1 was clinically normal. Let's see, 1 clinically normal, 2 mild systemic disease, 3 severe systemic disease, 4 severe systemic disease that is a constant threat to life, and 5 is moribund and not expected to survive a day without surgery. And so you have to know that for your surgery boards for those surgery residents. Okay, the results. 27% of cats and 31% of dogs had anesthesia in that time frame. So about a third of animals have anesthesia over those years. Anesthetic-related death for cats, 11 deaths per 10,000 episodes, which is 0.11%. Dogs is 5 deaths per 10,000, which is 0.05%. Comparison of these death rates reveal that cats were more likely to have death than dogs. And that makes sense. Cats are usually smaller, they weigh less, they are more lean muscled, so they are at risk of having hypotension from anesthesia, risk of hypothermia with anesthesia. Cats also tend to be much more subtle when they're sick versus dogs, which are more obvious. So if you have to do anesthesia on a sick cat, it's probably been sick for a while and wasn't showing symptoms at home. Versus dogs, you can tend to pretty quickly because they tend to show symptoms more outwardly. The timing of death for patients, I'm not really sure how this breaks down because they mention here general sedation and so general anesthesia and sedation, and then they go into more numbers. So I'm just going to read it as they say it. So timing of death at induction, 11% for dogs, 25% of cats. During anesthesia, 18% dogs, 24% cats. After anesthesia but before discharge from the hospital, 10% dogs, 15% cats. After discharge, dogs, 60%, cats, 37%. These proportions were similar for patients in the general anesthesia data sets, which showed at induction 9% for dogs, 16% of cats. During anesthesia, 16% in dogs, 25% in cats. After anesthesia, before discharge, 11% dogs, 19% cats. After discharge, 63% dogs, 40% cats. Of the 69 case dogs in the general anesthesia and sedation data set that died after hospital discharge, 25% had death of or euthanasia recorded in the patient status field on the date of the anesthetic episode. 41% had deaths recorded between 1 and 2 days after anesthesia, and the remainder, 35%, had death recorded between 3 and 7 days after anesthesia. For this study, they stopped looking at records after 7 days. Of the 33 cats in the data set that died after discharge, 24% had death or euthanasia recorded in the patient status field on the date of the anesthetic episode. 24% had death between 1 and 2 days after. The remainder, 52%, died between 3 and 7 days. The most common dental procedure was dental cleaning that was performed. That was, the most common in cats and dogs. And then it was the second most common surgical procedure for dogs, where GI was the most frequent and was also among the most common procedures for general anesthesia. A bit confusing of a sentence, but basically dental procedures are most common, and then GI is up there as well. ASA status of at least 3 versus of at least 2 or less, so at least 3 or more or 2 or less, had a significant increase in odds of anesthetic-related death at 3 times and 4 times. Odds of anesthetic deaths in dogs and cats also was affected by hematocrit. The odds of anesthetic death increased with increasing age. So for every 1 unit increase in the square root of age in years, the odds increased twofold. In other words, the odds of death for a 9-year-old cat was twice that for a 4-year-old cat. Dogs that underwent non-elective procedures had between 85 and 91 times odds of death than those that went elective. So typically with non-elective procedures, dogs or animals in general are sicker because it's non-elective, which means you're doing it because they need to have their life saved. So it makes sense that non-elective surgery would be higher risk than elective being planned ahead and you chose to do it, but it's not required for saving the life. Dogs with no record of pre-anesthetic physical exam had over 267 times odds of death than those with a record. Now, that could be just poor medical record keeping. It also could be that the dog was so sick that the doctor didn't have time to write the record. That's how I'm going to take it. But it could also be like they didn't collect proper records, or records were lost, or whatever. It is not to mean that if your doctor doesn't write up your dog's physical exam record before anesthesia that your dog's going to die. This is just, I think it's more maybe an association, but not causality. Dogs with an underweight body condition had 15 times odds of death compared to dogs that were not underweight. Odds of death for dogs with a hematocrit outside reference range were 5.5 times high likelihood. No other hematologic parameters were significantly associated with the outcome. For cats, increased age had increased death. Similar to dogs, the odds of death for cats that underwent non-elective was between 5 and 6 times that for those cats that went elective. Makes sense. Lack of a record of intra-anesthesia oxygen monitoring had a 5 times increase of death in cats, and almost 35 increase for general anesthesia. Again, I think it's the same thing where they're so critical that they didn't have time or weren't thinking about putting pulse oximetry on these animals, but it's hard to say what the cause is there. Increasing body weight had increased odds of death for cats. Every 1 unit increase in the square root of body weight in kilograms increased the odds of death 8-fold. Okay, discussion. Anesthetic-related death rates for all cats and dogs were 11 deaths per 10,000 for cats, 0.11%, and dogs 5 deaths per 10,000 episodes, which is 0.05%. The cats that underwent anesthesia were significantly more likely to die than dogs. Another study found the anesthetic rate in cats, 0.24%, appeared to be higher than for dogs at 0.17%. Another study, odds of anesthesia-related deaths for cats did not differ from dogs. In the study reported here, the postoperative period was the most common time of death for dogs at 70%, cats 52%, with a large proportion of all case animals dying after discharge. Dogs 60%, cats 37%. Another study for deaths in postoperative period, 47% for dogs and 61% for cats. Among these factors, there were no hematologic factors that were significant. Dogs that underwent sedation were over 5 times, and cats over 12 times is likely to have death related to their counterparts that underwent general anesthesia. So short sedation had more likelihood of death. That's interesting. It might be that you don't have control of the airway with sedation as defined here, and so if an emergency happens, you're less likely to save them. It could also be that they were so sick that they only needed some sedation enough for surgery, and so maybe they were higher risk animals. It also could be poor medical habits, where if you're just sedating something, you're not monitoring them as much as well. Also, we are less likely to warm up animals that are just sedated because it's going to be usually a quick procedure, so they're on a cold table and they become hypothermic. None of these things, by the way, as far as I can tell, were discussed in this paper, so I'm just telling you what my thoughts are on it. All right, some of these factors, such as increasing age, have been reported previously. Lack of documentation of a physical exam, increased odds of death in dogs. They mentioned that for cats, a fractious temperament was not identified as a risk factor for death, nor was it correlated with lack of physical exam. They were saying that if you did not have a physical exam in cats, maybe it's because cats were more fractious, but may not be the case here. With respect to cats, failure to document SpO2 readings, so oxygen readings, had increased death. This failure may have been attributable to weak pulses, low blood pressure, or impending cardiac collapse, which could be early warning signs. Other findings for the oxygen measurements were in agreement with those of another study that found that the use of pulse oximeter had a protective association against anesthetic death in cats. For dogs in this study, overweight body condition was not associated with increased odds of death, but underweight was. Another study found that dogs that had a low body weight, 0 to less than 5 kilograms, were almost 8 times as likely to have anesthetic-related death as were dogs that were weighed between 5 and 15 kilograms. For cats, the odds of death increased with increasing body weight, but only for cats with general anesthesia. This variable, in the sedation category, this variable was not non-significant for general. And another study involving cats' body weights of less than 2 kilograms or over 6 kilograms had increased odds of death versus cats that were between 2 and 6 kilograms. Cats and dogs undergoing non-elective procedures had a higher rate of death. This is also consistent in previous reports where cats and dogs undergoing major procedures had higher risk of death. And then the only hematologic variable was hematocrit for dogs, 5.5 increase of death. Another study looked at pre-anesthetic screening was of little importance compared to the importance of having a more thorough patient history and physical exam. And that makes sense. I mean, you always want preoperative blood work. You should. But the history and physical exam findings play a huge role in this. Although failure to record general physical exam findings was associated with greater odds of death, we need more studies to look into what factors influence that. Yeah, so that's the study there. Good, useful information. Obviously, it's a retrospective, so there's inconsistency with data collection and medical record keeping and whatever else. But it's hard with these types of studies to have to figure it out with anesthetic-related stuff. So good study there. And yeah, thanks guys for supporting the channel. We'll see you in the next one. Bye-bye.